Okay, so let's talk about the different types of medication for type 2 diabetes. First off, we're going to talk about the sulfonylureas and the meglitinides, which are similar in that they both have the beta cells of the pancreas produce more insulin, and they send the glucose out of the blood and into the cells. In addition to the side effects, important parts is that well, let's talk about the adverse effects first. Hematologically, the sulfonylureas might cause anemia or thrombocytopenia, and gastrointestinally you might have nausea or epigastric fullness and heartburn. And when you want to talking about the meglitinides, these have a similar mechanism. But what's different is that the side effects are different, and the side effects would be you would have a headache or hypoglycemic episodes, weight gain, and joint pain, arthralgias. So these are quite similar. Again, the sulfonylureas and the meglitinides. Okay, so the next drug we're going to talk about for type 2 diabetes are the biguanides. And when you think about the biguanides, the most common one might be metformin, and biguanides are the most commonly taken oral form for type 2 diabetes. And how these work is that they decrease the production of glucose while increasing the uptake of glucose, and decreasing the intestinal absorption of glucose while increasing the receptor sensitivity. One thing you want to be careful about when taking biguanides is if you're having a radiologic study and that if the radiologic contrast contains iodine and you're taking metformin, this type of biguanide, it may result in renal failure, so the person needs to be off the drug for at least 24 hours before they have a radiologic study. And the next form of type 2 oral medications for diabetes is the TZDs, the thiazolidinediones, and these are a newer generation drug, and they work by decreasing the resistance of the insulin receptors in the pancreas, and they increase the sensitivity of the insulin receptors in the liver, the skeletal muscle, and the adipose tissue. So again, they decrease the insulin resistance by increasing the sensitivity of the insulin receptors in the skeletal muscle, adipose tissue, and skeletal muscle. One of the side effects that you have to watch out for is an increase in LDL and HDL. So, and of course, the HDL being the good cholesterol and the LDL being the bad one. So anyway, so now we have talked about the sulfonylureas and the meglitinides, which are similar, but with slightly different side effects. And then the biguanides, and biguanides, a big example is metformin, and then the TZDs. So let's try to remember these.